Hi, I'm Holly Tanner, the Director of Education for the Herman and Wallace Pelvic Rehab Institute, and I'm joined here by Mia Fine, who is a sex therapist. I'm going to let her tell you briefly about her background and training and credentials and the course that she has curated just for Herman and Wallace.
Thank you so much, Holly. Yes, my name is Mia Fine, and I'm an ASEX certified sex therapist and a licensed marriage and family therapist. I also offer medical family therapy in my practice, private practice, and group practice here in Seattle, Washington. And I am so excited to teach at Herman Walls for the very first time. We're going to be discussing and teaching sexual health interviewing for providers and from a biopsychosocial, spiritual, holistic perspective.
And so, Mia, clearly you are a discipline that isn't necessarily a rehab provider, as many of the folks who attend coursework are at Herman and Wallace. Where do you see the overlap? What is it that you can impart from your knowledge, skills, and training that you feel does fit within the scope of us pelvic health providers? And where is that really nice overlap?
I think that's such a great question. The time that you and I met with your patient, I think it was really clear how that overlapped in terms of the questions one can ask within your scope that can invite a patient to offer information that would be really helpful. And as sex therapists, we definitely navigate much more of that mental health perspective. However, if we think of this as a Venn diagram where you're in the body, right? You're a somatic practitioner. We have this beautiful overlap that is the holistic perspective. And I'm really looking forward to inviting the folks who attend this course to learn all about how to gather information that your patients don't even know they are allowed to or able to offer that can be really helpful for providers.
You know, Mia, one of the strengths that you have is really understanding, probably from your own perspective, but also from the work that you've done with the clients who you see and the interdisciplinary work that you do with a whole bunch of other folks. You really understand what barriers people face in confronting their own fears around accepting their own sexuality, addressing pleasure and shame, and also talking to other people about topics that we weren't necessarily taught how to dialogue about. So, how can you invite people to really maybe face some of those challenges or fears, or really understand that when you don't know what you don't know, that it can really create some lack of connection with the clients and ability to help them move forward.
Big time. So people are afraid of what we don't understand. And part of what this course is going to offer, not only language that's current and up to date, we're going to explore and examine sexual orientation, sexual expression, and how that is different from gender identity, assigned female at birth, assigned male at birth, intersex. We're going to go into a lot of those definitions as they currently are today. And as you know, language is constantly evolving. So those messages that we receive that you just referred to are embedded in us. The messages that we receive from culture, from our family of origin, from the society, from education, all around us have a huge impact on how we show up in the world and how we relate to other people. And again, as we talk about that Venn diagram where they overlap, what we're going to do in this course is start to unpack the messages like a garden, right? Like sometimes messages can be insidious weeds and we have to navigate them and then start to pull them out with intentionality and care so that it doesn't ruin everything else in the garden. So that's what part of this course is going to be, is identifying what messages really can play an integral role in pelvic floor pain, and also how to navigate that with the patients with whom we work.
Now, the course is titled around sexual health interviewing, and that might make it sound like it's biased towards the evaluation
Mm,
aspect or collecting the subjective data. But
mhm.
really, this course is also very intervention based and is designed around the scopes of rehab providers. So, what kind of interventions can folks expect to learn about so that they can really dialogue with their folks who they're working with? And that might mean around actual interventions they can help the patients with, or referrals to appropriate providers.
I love this. Absolutely. So, as you know, I'm huge into resources. So, I have tons and tons of resources. We're going to talk about how to collaborate with different providers and what that looks like. We're going to do some practicing in terms of lab work around how to discuss certain cases with providers. I'll bring cases into the conversations that we're going to have over the weekend as well. Talking about, and this goes back to that question around barriers, timing constraints, ethical, legal barriers that people are afraid of. We're going to discuss how those impact the questions that we ask and how to do open ended and closed ended questions in a way that really gathers information that's necessary for our patients' care.
Some of our participants might recall the lecture that you did with us for the 2A course, just really looking at boundaries and communication with folks in various populations and about language and avoiding harm. All of those
Mm,
things are that relate to trauma, which
yeah.
is very also associated with pelvic health and dysfunction. Now, how do you see your role? I know that you are constantly learning. You are constantly challenging yourself, and you have mentors. You take trainings. And of course, when you're a teacher, you're always learning because people ask you things you don't know. And so you go and research. So I also know that you are working on writing your PhD thesis
I
recently,
am.
right? Yeah.
Yes.
And
Yes.
so, what is it that drives you to keep learning and to keep digging up this material and really dedicating your time to these worthy endeavors, but that really are also a sacrifice of your time, energy, and money, as so many of the participants are doing when they come to this coursework?
There are a couple wonderful components to that. The first I heard is about mentorship and constant learning. As long as I'm working with human beings, regardless of how many letters are after my name or how many titles are in my email signature, I will seek supervision. I'll be in mentorship groups. I'll have one on one mentoring. I'll seek, as I said, supervision and consultation. As a clinical supervisor, I also think it's really important to stay humble and curious. Again, I hope to be doing this work for as long as I'm alive in some capacity or another. And I think leaning into curiosity and openness is just kind of part of what makes me a big nerd around sexuality, around education, around how to work with human beings.
Yeah, and what is your PhD about?
It's actually very in line with this course. It is an inclusive guide to clinical care for working with human beings who experience pelvic floor pain. So it's like kind of a long phrase to encompass what this is. And it's exciting. It's a book right now, and it's based on a couple of the courses that I teach for Antioch University and Institute for Sexuality Education and Enlightenment, IC. So, yeah. It's very similar to, there are a lot of components in the book that I'm looking forward to teaching in this course in a couple of weeks. And the book should come out in a couple of years. I'm about midway through my PhD dissertation.
Wonderful. Well, thank you so much for sharing your thoughts. And I know our participants are so lucky to have you on faculty. And we're real grateful that you, again, created this course for folks who work with this population. Looking
Thank you. I'm looking forward to it. I'm really excited to teach with Herman and Wallace, and I can't wait to meet the students.
excellent. All right, we'll talk soon.
Sounds good.